have started recording. I will go ahead and start at 1:02 p.m. the April 2nd, 2024 Council on Food Security meeting. My name is Sarah Rogers. For the record, I am the Deputy Bureau Chief with the Bureau of Child, Family, and Community Wellness. I will be doing roll call today. I do want to note that we have a couple new administrative assistants with the Chronic Disease Prevention and Health Promotion Program. So Paige Musser will be taking over roll call and administrative duties at the upcoming meeting. So I will do today, and then she will take over for me after that. And you should, she should be the owner of the meeting invite now that you guys all have. Okay. So I will go ahead and begin with roll call. Allison Janko.
Present.
Dr. Pamela Janelle.
Present, and it's so good to see everyone. I've missed you.
Nice to see you, Dr. Janelle. And Tori Lawson Buffelli.
Present.
Deacon Tom Roberts.
Good afternoon.
Vicki Ives.
Hello, present.
Sorry, you got a head bomb. Oh, Jeff told me he's not going to make it today. Kelly Cantrell.
Here.
Dr. Dorian Stonebarger.
Present.
Dr. Goycochea. Dr. Osgood.
Present.
Thank you. Dr. Malik.
Present.
Jesus Mendoza. Lisa Swearingen.
Present.
Marcia Blake.
Present.
Maria Minivar. Marie Baxter. Maurice Johnson.
Present.
Okay. Let me verify we have quorum real fast. And we do have quorum.
Okay. Great. Thank you, Ms. Rogers. At this time, we will move to agenda item 2, public comment. Public comment may be presented in person, by computer, phone, or written comment. No action may be taken upon a matter raised under public comment unless the matter itself has been specifically included on an agenda as an action item. To provide public comment telephonically, dial 775-321-6111. When prompted to provide the meeting ID, enter 650-810-653#. Due to time considerations, each individual offering public comment will be limited to not more than 5 minutes. Persons making comment will be asked to begin by stating their name for the record and to spell their last name. Please avoid using acronyms or define any acronyms used. A person may also have comments added to the minutes of the meeting by submitting them in writing, either in addition to testifying or in lieu of testifying. Written comments may be submitted electronically before, during, or after the meeting by emailing Lori Taylor at l.taylor@health.nb.gov. You may also mail written documents to the Division of Public and Behavioral Health at 4150 Technology Way, 3rd floor, Carson City, Nevada, 89706. So at this time, I will open it up for public comment. Does anyone have any public comment they would like to make? Ms. Rogers, please go ahead.
Thank you. I just wanted to let council members know that there will be some food insecurity presentations coming up at the next joint standing interim committee on health and human services meeting on April 8th. They reached out to the state and a couple of food security partners for presentations. So I just want to make council members aware of that in case they're interested on listening in on those.
Perfect. Yes, thank you. Thank you for making sure the council was aware. I will be at that meeting. I know we have we'll get to that agenda item later, but they reached out. We had a goal to reach out to the Legislative Committee on Healthcare to present and ask for additional seats to add to the council, but they reached out to us to present. So I will be presenting to the committee next Monday. So thank you for bringing that up, Ms. Rogers. Who do we have next? Ms. Taylor, please go ahead.
Hi, can you hear me?
We can.
Hi,
Please go ahead.
This is Lori Taylor for the record. I am just going to drop in the chat a link to the Silver State Health Improvement Plan that was released. And it's the 2023-2028, which is currently what we're just working on the food section of this plan, but I do think it's important that at least I can drop some information about the plan and the link to that. So if you're interested in accessing the entire plan, you can do so. And then I'm also going to drop a link related to the recent report from Feeding America. So Jenny, thank you from Food Bank of Northern Nevada for providing that information. It's going to be basically, it's a great snapshot of some experiences, concerns and ideas of people facing hunger in our states. Even though it doesn't specifically indicate Nevada, there's a lot of valuable information in that. So I have the report and the executive summary. So I'm going to drop those in the link now or in the chat. And that's all I have.
Thank you, Ms. Taylor. Do we have anyone else for public comment? Okay. We'll go ahead and close agenda item 2 and go to agenda item 3 for discussion. Approve upcoming meeting dates and times. We have the next meeting is July 16th, 2024 at 1 o'clock. Just a quick reminder for our next meeting, it will be in person, but we are maintaining a remote link as a courtesy for the public. We have 2 locations. We've got the Carson City location at 4150 Technology Way and room 303. That's the boardroom at the Division of Public and Behavioral Health. There is a button to be buzzed into the building in the front, and you just have to let the front desk know that you're there for the council meeting, and they'll let you go upstairs. And they'll take you to the 3rd floor to sign in. And then the Las Vegas location is at 1501 Las Vegas Boulevard in Las Vegas. And then, like I said, there will be a remote option. And then for our October 15th meeting is again at 1 o'clock, and that is a remote option. So I'm looking forward to seeing you all that can be there in person in July. And then again, remote in October. Any questions about the meetings? Dr. Janelle, please go ahead.
Dr. Pam Janelle, for the record, thank you for sharing this information regarding the meetings. Will the October meeting be in the same location as the one listed in July, or are we like moving around to be friendly with the community?
No, the October meeting will just be remote. So we'll have it a Teams meeting, just like how we're doing today. So we'll have in person for October. So we'll have three different options for folks. So we can meet in Carson City, and then we'll have the option for folks in Las Vegas to meet there. And then there will also be a remote option that day for folks to meet remote if they cannot be in public that day. And then for October, it's just remote, no in-person options.
Thank you. And one last question with regards
Sure.
to the food presentation on the 8th. Is that at 1 p.m. as well?
No, that presentation, the meeting starts at 9 o'clock for the interim health committee. I'm not sure when our presentation is slated for. Well, it's tentative at this point. Miss Rogers, I
you.
don't believe that they clarified when we were supposed to go on. I can't remember.
Yes, no, we don't have a set date. I know there are quite a few presentations slated for that day, so they're going to be talking about multiple topics. So it, depending on how long each presentation is, I don't have a set time.
Thank you for your help with that.
Thanks, Dr. Janelle. Deacon Tom, please go ahead.
Thank you. Just as a point of clarification, 1501 Las Vegas Boulevard is north. It's important to add the N onto your, if you're looking for, to use your map finder on your phone, so you don't end up at the Bellagio or New York. And that is the main campus for Catholic Charities. We will be meeting in the administration building. And when you pull in, for those that maybe have not been there before, there will be a checkpoint, a security guard checkpoint. They'll be aware that you're coming and they will direct you to parking. But just so you know, the meeting is in the boardroom in the administration building at 1 o'clock. And we're happy to have everyone come and meet with us there.
Great. Thank you, Deacon Tom. And thank you so much for donating your facility to have the meeting there. We're really looking forward to having it there. So thank you so much. Any other questions about the in-person meeting and the October meeting? Okay, great. We'll close agenda item number 3 and move on to agenda item number 4 for possible action, approval of the January 16, 2024 meeting minutes. Any questions, clarifications about the January meeting minutes? Okay, at this time, I will accept a motion to approve the January 16 meeting minutes.
Doreen Stoneberger, I make a motion to approve.
Marcia Blake, second.
Okay, all those in favor?
Aye.
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 Opposed, nay? All right, motion carries. Thank you. Now we'll move to agenda item 5 for discussion. We have a board certificate of appreciation for Dr. Osgood. Dr. Osgood has served I think it's 3 consecutive terms on the council on food security, which I think the max amount of terms, which is impressive. So I just want to take a few moments to recognize his service to the council, and thank him for his work. And I think you, Dr. Osgood, have been have been on the council since its inception. So I just want to give you a moment to just talk about some of the work you've done and give others a quick few seconds to just thank Dr. Osgood. And the floor is yours, folks.
This is Dr. Osgood. I don't know what to say. Yes, I was contacted by it's 3 governors ago now, Sandoval, since he knew that I was involved with food insecurity going back many years, and asked if I would be part of the council. So I was one of the original members. And I don't know, Deacon Tom, were you there at that time? Remember, one of the first things that we found out was that 3 Squares didn't have enough food, and that all the casinos were throwing away all their food. So the very first meeting the council had with the community was with the hotels. And we arranged, they were very kind, and they said they'll stop throwing away their foods and they'll start giving it to the food banks. And sooner than later, the food banks had enough food to be able to meet the demand at that time. I remember, Marcy, were you involved when we decided that we only wanted to, that the first age population that we were going to try and find out what their needs were and the gaps were with the school age kids?
Nope, I
Well,
didn't join until we started focusing on seniors.
Oh, okay. Well, the first group, we divided. I remember that I guess it was Catherine Sandoval who said, listen, we can't take care of all the needs because every population age group has its different needs. And so we divided the population arbitrarily into preschool, school age, um, adults up to age 60, and seniors. And the first group that we addressed was the problems of the school age kids. And Deacon, were you one of those who asked the schools? I was giving some programs in diabetes at that time to the schools, and found out that every school, in order to meet the SNAP program, had to have 6 different refrigerators because SNAP was so complicated that the kids in the schools wound up having 6 different SNAP programs they were enrolled in federally, and each one had a different storage requirement. And so none of the schools could afford that. Remember that? And
Well, we had a lot of discovery in those early days.
we sure did. There were a lot of obstructions. There was a transportation obstruction. Anyway, I won't go through it all, but we contacted our federal legislators, and they got actively involved and persuaded the Department of Agriculture to make it only one requirement for storage instead of 6 different ones. And lo and behold, the schools could afford to have the SNAP program. I remember that. And I won't go into everything that happened at that point in time, but we went through a lot of those. Second group was when we decided after we addressed the seniors, although we never completely addressed the seniors because if you guys recall, kids in junior and senior high school, mostly junior high school, they were embarrassed if they were getting signing up for the SNAP program, and they wound up not eating lunch or eating breakfast just so that they wouldn't be humiliated. And there was some significant mental health issues that, to my knowledge, have never been fully addressed, except that we did get the free lunches and breakfast for everybody, and that eliminated the state funded that, and that eliminated the kids, the issues that were associated with mental health issues for kids, and it involved several hundreds, if not thousands, of kids. But that's now come back again, as you all know, because of the issues of having our governor veto or they've stopped the food security, the food distribution now, the free food distribution. Anyway, I'm talking too much. You guys all know about the senior stuff because I shared that in the last few times, and we still have some real issues. Actually, the issues with the senior stuff that I've been aware of that still exist are more the homebound seniors. The Meals on Wheels have helped dramatically, but I know a lot of people who are involved in the home health care issues from the hospitals, and they still don't have enough staff to be able to make sure the meals are cooked right and stored right and everything else. So there's still an issue that related to that. Anyway, so much for me talking. Thank you very much.
Thank you, Dr. Osgood. We certainly appreciate all your years of service to the council, and we hope that you continue to participate in these meetings as a non-voting member, and we appreciate your input as always. So thank you very much.
Let me make just one other comment. I shared with you guys the research, some of the basic stuff that Aurora Buffington and I shared when we did the research on the seniors. And if you can age adjust that, I gave it to, I think it was this, I forget who I distributed it to you. And if you need any of that background information and you're willing to go forward, and you can get the staff to do some age adjusted research of what the gaps are, I'd be willing. If you need any help, just give me a call.
Great. Thank you, Dr. Osgood.
Mhm.
Appreciate it. All right. Any other comments or Dr. Osgood? Ms. Rogers, please go ahead. Did you have something?
Sorry, I can't figure out my hand raised for
It's
some
okay.
reason.
Go ahead.
I did just want to point out that we didn't get it on the agenda, but I do also want to recognize that Ginny Yeager's membership has also expired. So she was also provided with a certificate of appreciation. And we will be, I know it's another agenda item later on, but we will be looking also to replace the Food Bank of Northern Nevada seat on the council as well. I wanted to recognize Jenny.
Yes, thank you. Thank you for reminding me. Yeah, last minute add to the agenda. And Jenny is here. She's just hiding. But want to also recognize Jenny real quick. I so appreciate Jenny's participation and all of her thoughtfulness on the council. I think she's just a wonderful addition, and I just appreciate you so much, Jenny. So you totally don't have to make any comments if you don't want to. I won't put you on the spot, but if anybody wants to recognize Jenny, please go ahead. I just know I appreciate you very much.
Thank you for that. I appreciate that. I have loved my time on the council, and I just thought it was a good opportunity for another one of my colleagues to be able to step into a leadership position around food insecurity. So I'm not going anywhere. I'm still at the food bank. So if anybody ever needs me, wants to reach out, has questions, I'm here for that. And I support the council 100%. But thank you to each of you guys because you've had an impact on me. Thank you guys.
Thank you, Jenny. And same extension of we certainly hope that you continue to participate as a non-voting member. Your knowledge and wisdom is certainly welcome on the council. So we hope we see you again. This is not goodbye. It's just see you later. All right. Any other comments or questions? All right. Okay, I'm going to close out agenda number 5 and move to agenda item number 6 for possible action. Discussion and possible action to recommend Charlotte Williams for appointment to the Council on Food Security to fill the position of a person who is a representative of a food bank serving Northern Nevada. Hang on one second. Let me grab my notes. So this is actually the position we would be replacing Jenny with for the Food Bank of Northern Nevada. So right now, and Miss Taylor, can you just help me fill in the gaps here real quick? I believe we have Charlotte's resume. We just need to approve her recommendation for the appointment, correct?
Hi, this is Lori Taylor from the record. That is my understanding. I know Sarah has been through this process before, so Sarah, feel free to jump in. We have 2 resumes that we added. One is Jill Moe's resume, which is for the representative of farms, and then Charlotte's resume is for taking the place of Jenny's and representing the Food Bank of Northern Nevada.
Yes, that is correct for any of the seats that are not position specific, such as the director of, the administrator for Division of Public Behavioral Health. Other seats the council should vote on. So you just get a majority vote for those incumbents as they submit their resumes for consideration.
Okay, great. I'm sorry. Go ahead.
No, that's okay. I was just going to also add to it. This is Lori Taylor for the record. That the current vacancies that I show on the vacancy list is we have, just so the group is aware, we have one member who is a representative of persons engaged in the business of processing and distributing food. We have a member who is representative of gaming industry, hospitality industry, and restaurant industry. We have another one open for farmers or ranchers engaged in food production. And then we have another one for retailers of food, and then the manufacturer that is not related to food, and then such other representative of the state as may designated by the governor. And then Dr. Osgood C., which is going to be the representative of local health authority. So those are the ones I currently have listed just for. And I know a few board members had received an end date on their term and some renewing and how to renew those seats and instructions for that as well. So if you have any questions on that, you're welcome to please, you're welcome to email me anytime you need to. And that's all I have.
Okay, thank you. Thank you for
Yes.
helping me just fill in the gap on that one. So I think at this time we can go ahead and move forward with voting to recommend Charlotte Williams for appointment to the council. So I will go ahead and accept a motion on that.
Doreen
Dr.
Stonebarger.
Oh, go ahead, Dr. Stonebarger. Thank you.
Doreen Stonebarger, I move to approve Charlotte Williams' appointment.
Dr. Pam Janelle, I second the motion.
Okay, all those in favor say aye. Aye.
Aye.
Aye.
Hi.
Opposed, nay. All right, motion carries. And Miss Taylor, I think for the next meeting, we can put Jill Moe on to move forward for her appointment once we get her resume. Correct?
This is Lori Taylor for the record. I see that Jill Moe's resume is in the packet.
Oh, it is. Okay.
Yes, it just
Totally
didn't
missed
make
it.
its way to the agenda, unfortunately, but it is in the packet.
Well, then,
Can we move forward, Sarah, with that since it's included in the packet? No.
Yeah, we should be good to move forward.
I can share my screen too if need to
okay.
be.
I must have missed that. Okay, if the council is comfortable, then I will accept a motion to recommend Jill Moe to fill the seat as a representative of farms to the council.
Dr. Pam Janelle, I second that motion.
Do we need it? We need a first motion?
I need
I'll
a
make
first.
I'll make the first motion.
I was like, Dorian.
It's
my
on trend.
first.
I'll just.
My apologies. Oops.
I'll make the first, Doreen Stonebarger, for the record.
Dr. Janelle, are you my second?
Dr. Janelle, for the record, and I correctly this time second that motion. Glad to be back.
Perfect. All those in favor, say aye.
Aye. Aye.
Hi.
Aye.
Opposed, nay. Motion carries. All right. Then we will close out. Where am I? Sorry. Agenda item 6. And move to agenda item 7 for discussion. We have the Division of Welfare and Supportive Services presentation on SNAP updates related to summer EBT and able-bodied adult without dependence waiver. Ms. Cantrell, please go ahead when you're ready.
Good afternoon. Like Allison said, I'm Kelly Cantrell with the Welfare Division. And I've just got a couple things that y'all might be interested in this afternoon. Summer EBT is a big item that we're working on right now. You probably all already know, but just quickly, it provides SNAP benefits for children who qualify for the free and reduced lunch program to have benefits over the 3 summer months. So it's $40 a month. Over the 3 months, it's $120 per qualifying child. And it's just to kind of fill that gap, right? While they're not getting those meals during the school year. We anticipate that close to 30 million children in the entire United States would be assisted by this benefit, with 350,000 of those children being here in the state of Nevada. So it's a heavy lift. We have to get this into the hands of families no later than September this year. And so we're working feverishly to get that done. We did submit our letter of interest to FNS. They know that we're on board and trying to get this done. Next year, just so you guys are aware for future, these benefits will have to be out before the school year ends. They've talked about this, but we didn't get the interim final rule until December of last year. So it's literally just a few months ago. So you guys can kind of understand why we're just kind of trying to put everything together. And so they've given us to the end of September to get the benefits out this year, which doesn't necessarily help for the summer, but it gets hands, right before, hopefully by back to school. But I'm excited about this program. It's completely independent from SNAP. It is SNAP benefits, but it's a completely new program that we should be able to do every summer. And we'll know more as we move along. But that's hopefully coming to families by the end of September. Everything works out as it's supposed to. The next thing that I'm super excited to talk about is Nevada qualified for another year of ABOD waiver. So all the new ABOD requirements that went into effect as part of the, was it the Consolidated Appropriations Act, I think, that changed that. Nevada gets another year. So through June 30th of 2025, we won't have to implement ABOD rules here in the state of Nevada. So I don't know if you guys know, but ABOD used to be, it's able-bodied adults without dependents. And it basically says anyone between the ages of 18 and 49 who are able-bodied and able to work have to meet certain work requirements in order to continue to receive SNAP benefits. And so there are exceptions to some of those, like if an individual is unhoused or a veteran, they do make allowances for some of that. But we're good for a whole nother year, so we will not have to put that into place, at least as of now, until 7/1 of 25. We weren't sure we were going to get another year. And I guess it's a blessing and a curse because that means our unemployment rates were high enough to get it. But I'm happy that we're not going to be removing people that could utilize those benefits and continue with that service. So I'm kind of happy to report that. We are looking at completing a waiver so that we can start taking SNAP applications telephonically. We haven't been able to do that in the past because we didn't have the capacity to hold that signature, store that signature as required, and to store the attestations, right? The requirements, the rules, do you agree to this and that? And so instead of trying to get those rules implemented and get all that on board, we're going to request a waiver for the next year to get our ducks in a row so that we can store what we need to store. But FNS did make that waiver available, and we are going to pursue it so that we can start taking applications over the phone before we're actually able to store the applications as required. So that's coming along here, hopefully sooner rather than later. There's just a lot of big things in food stamps in the SNAP program right now, as you guys are aware of. We've actually done some pretty good exploration on the restaurant meal program. I know that there's mixed emotions on the restaurant meal program, so I'm not without knowing that. For anyone who may not be aware, it's a program that allows elderly, disabled, and unhoused individuals to utilize their SNAP benefits at restaurants, at participating restaurants. And so if it's an individual who can't cook for themselves, or someone who maybe doesn't have a kitchen or a stove, or it allows them to go into restaurants and utilize their SNAP benefits and get a hot meal. And I was surprised. So when we started, and we just have done some exploration, we've started talking with local restaurants, if you will, because I just don't want a program that just is all McDonald's or Burger King. And not that I'm saying there's anything wrong with McDonald's and Burger King, right? But nutritious food would be nice, right? And I was surprised we got places like Teriyaki Madness that was interested. And right? And I know I think that that's a healthier option than a fast food restaurant. And we got places like, I don't know if you guys in the North would know, but Don Tor Taco, which is like Roberto's, if any of you are familiar with that. And so it's we're not just seeing the fast food places show interest, which I was pretty excited about that too. So we're in the infancy of exploring that. We know that there are places interested that aren't your traditional fast food restaurants, and I was super excited about that. And that was just some exploring in the South that we did. And so I'm hopeful that we can convince other participants with healthier food options to be a part of that. So that's really the big updates that we have. We've been in talks with Sarah and her team over at WIC about some collaboration between the two groups to kind of help make sure that we don't have gaps, and that the folks on SNAP are getting the WIC if they qualify, and vice versa, if they're on WIC and they qualify for SNAP, that we can get those individuals the gaps filled, right? Because we know that there's probably people on both sides that aren't utilizing the full benefits that they're able to do. So we're starting that off, just starting it off really. We've always done referrals, but we're going to start training our staff on how to recognize basic WIC eligibility so that they can say, yes, you're over income for SNAP, but did you know that the WIC income eligibility limit is this? And kind of just give them a little bit of options, if you will. And some of this is in its infancy. We did throw around maybe co-locating some WIC staff in a couple of our offices that have heavy foot traffic and stuff like that. So we can report on that as that gets moving down the road maybe, but those are just a few of the things that we're working on in SNAP. And some things that we're working with WIC to try and fill some of the gaps, try and reduce the food insecurity that's out there. And that's just kind of where we're at today. So if anyone had questions, I'd certainly welcome fielding any questions that you guys have, but that's where we're at. I see a hand, but I can't see whose hand it is.
Deacon Tom, go ahead.
Yeah. Oh, Deacon Tom.
Good afternoon. I just want to say, Kelly, thank you for that report. We have a WIC clinic and a food pantry at our main campus in Las Vegas Boulevard, and we see about 4,000 WIC clients a month there, and over 150 food pantry clients a day. And so the ability to have that crossover, the cooperation, makes such a huge difference for people that come in and find that maybe they can't get the benefits that they thought they would get. And then they walk away knowing that they get some benefit. The help and the hope that creates, the hope is priceless, and the help is important. And so just wanted to say thank you from a person that's on the ground living both of those programs every day with some of the most needy people that are really working to do the best they can to put food on the table. That ability is a blessing. So thank you.
Most welcome. Yeah, I thought it was a good meeting that we had, and I came away feeling pretty hopeful myself. So thank you for that.
Dr. Malik, please go ahead.
Hi, Kelly. This is Dr. Malik for the record from UNR Extension and Southern Nevada Food Council. Thank you so much for putting that restaurant program together. We've been trying to look at it from UNR Extension as well, and have only been able to see what other states are doing. There's the community in Searchlight really only has a Denny's. They don't have a grocery store. They don't have anything. And so we were trying to get them to be part of a program like that so that people could get like an omelet, Yes. If there's any way that we can connect and speak on that further, I would love to meet with you.
Yes, I'm absolutely willing to do that, because one of the things that we need to help, like a place like Denny's or another place that offers food, healthy options, is that those folks need to be willing to go out to FNS themselves and say, hey, I want to do this, because they have to be able to be a point of sale, right? So they have to have a point of sale. You know what I mean? One of those little thingies that you put this, my brain is failing me, but you know what I mean, right? They have to be able to take the card. And so there is some legwork on the participating restaurants. And we're hoping not to lose people when they hear some of that. But I do have a team that is well versed in it and can go speak to the partnering restaurants if we need to. And it sounds like we may need to do that in Searchlight. And it's just kind of a Q&A and what it looks like and what they would need to do in order to participate. And we certainly could try to help them in any way we could. But I do think it's important for them to understand that, because if they don't agree to participate, we're not going to get very far in having locations for people to be able to utilize. So yes, I think connecting would be a great idea.
Absolutely. We have a whole list from Slow Food Las Vegas, where they rank kind of a healthier restaurant based on a variety of different things. But they, I think, would all love to be part of that program, and they're all in downtown Las Vegas. So I would love to connect with you. Thank you so much.
That would be amazing. That would be amazing. Thank you. Because you don't know where to start, right? Like I'm in the social services business, and not necessarily knowing where the healthy restaurants are may not be something I'm super good at, but if I could connect with you who has an amazing, I'm absolutely willing to do that. That would be amazing.
Yay, I'm so excited. Thank you.
Yes. Because I'm going to tell you, I know that there will be pushback on some of this for the flip side. And this has happened in other states, and it hasn't been wildly successful. And it has been that there's only fast food restaurants, and how does that look and what does it look like? So if Nevada could do it different, that's really the way I would like to do it. I think different and better, right?
Marsha, please go ahead.
So we have a home delivered meals rule program. We are currently serving 30 seniors in Searchlight and 185 in Laughlin. So we would love to be a part of that conversation as well, because if they qualify for our program, then they qualify for a lot of other programs. So we could help with additional, we only provide 20 meals a month. They definitely need more than 20 meals a month. So the opportunity to provide resources and information to them would be awesome.
That's great. One thing I want to mention, we are going for funding on this in the upcoming session. So you guys will be able to watch some of that as it unravels here in the coming months. But like I said, we've started doing groundwork and speaking to restaurants and kind of trying to do some public service and public awareness because we're going to need the help. So thank you. I really appreciate that from both of you and look forward to that collaboration for sure.
Any additional questions for Ms. Cantrell? I'm really excited to hear about the work that comes out of taking SNAP applications telephonically. I think that's such an untapped resource. And I'd love to, if you don't mind, like just in a couple of months, maybe in our October meeting, just reporting back.
Yes.
And just telling us how that's going. I'd love to hear if that's, if there's been more uptake, or I think that'll be really exciting to hear. So yeah.
Absolutely.
Thank you so much, Kelly. We really appreciate your update. And if there's anything the council can do to help you and advocate for more resources for you, just let us know.
Okay, will do. Thank you guys so much. Thank you all for the work that you do as well.
Thank you. All right. Well, then we will close out agenda item number 7 and move to agenda item number 8 for discussion. Home Feeds Nevada Program Annual Report from Senate Bill 370 from the 81st Legislative Session. We have the Nevada Department of Agricultural, wow, why can I say that? Agriculture presentation. Ms. Hoppy, I'm going to stop talking. And I'm gonna kick it over to you.
Okay, hopefully you didn't jinx me now by saying that. For the record, Patricia Hoppy, Division Administrator for Food and Nutrition with the State Department of Agriculture. How's that? So I do have a verbal report on Home Feeds Nevada. My director and I recently found out about this requirement. So we don't have all of the information that is in NRS Chapter 561, which came from Senate Bill 370, where this was created, but I do have quite a bit of information I'll share with you. So our timetable is October 1st, 2022 through September 30, 2023. Under expenditures, what we're looking at for that time period, food acquisition costs were approximately $2,167,474. Our transportation costs that we reimburse were around $10,430. And then we have a contract program manager that assists with the program, and the wages for that during that period was approximately $12,022. For units delivered, the amount of pounds procured delivered during that time period was around 1,543,460. And then one of the other things that we wanted to include was kind of like a sample variety of what we're doing with products from our producers, which include farmers, ranchers, and processors across the state, statewide. We have meat proteins, which was about a little over 105,000 at a total cost of about 490,000. We had fluid milk that was delivered to both of our food banks, around 70,867 at a cost of approximately 266,000. Honey, fresh farm raised honey, around 6,836 pounds for a cost of around 52,000. Cheese, and this is like good cheese. Like this is cheese you buy in the grocery store. This is not TFAT cheese or senior nutrition and wellness cheese or Fidipper cheese. So this is really good cheese, including shredded and 1 pound blocks, approximately 57,000 pounds at a cost of 161,000. And then fresh produce, which was the largest portion of our pounds procured and delivered, around 670,000 pounds statewide, at a reimbursement cost of around 1,070,583, which is the bulk of our producers. Sample produce items, because that's one of the things that we know that our food banks really need, that we have really been able to provide through Home Feeds Nevada. We have everything from greens to lettuce, spinach. We have summer and winter squash, radishes, zucchini, turnips, arugula, tomatoes, tomatillos, cucumbers, broccoli, beets, peppers, watermelons, apples, cantaloupes, apricots. We have a lot of different variety, and that's just a small sample. That's not everything that's being delivered. So that's a little overview report for the program. We have reached out to our food banks. There's some information that our 2 food banks that we need to get from them, and that would be number of people and households served, and also how they are doing distribution. So we've reached out to them to get that information, and then we will be incorporating that into our report. And going forward, we hope to be submitting a written report going forward. Does anybody have any questions?
I have a quick one, Patricia.
Okay.
Do you plan to ask for additional funding in your budget?
So we're working on that. We have 2 funding sources right now. We have state ARPA funds that are set to expire around 6/30/24. Although we know that we have a longer liquidation period, we're hoping that we might be able to get a little bit of an extension. But we are planning to spend those first. And then we also have federal funding from USDA in the form of the Local Food Purchase Assistance Grant. We refer to it as LFPA. That has a funding cliff of 6/30/24 as well. We are planning on asking for a no-cost extension through at least 12/30/2024, which we anticipate there not being any issues in us getting that approved in some of the conversations that we've already had. At this time, we have not really discussed requesting general fund or anything like that in our budget. We're obviously on the lookout for other funding sources because as many of you know, now I came into this late. I didn't inherit Home Feeds Nevada until spring of last year. There's no fiscal note attached to this bill, zero. So we are looking for other funding sources. You know, we have this conversation frequently in our meetings with our food banks. If they hear of something, we have this conversation with our Board of Agriculture at every quarterly meeting. We are actively searching for additional federal funding sources that can help feed Home Feeds Nevada. But right now, this is what we have.
Okay. No, that's really helpful. And we've had discussions about, you know, we know that ARPA is what has funded it, and LFPA has funded it, but wanted to see, you know, we know that you're building budgets right now, and
we
wanted to see if it was on the table. So I appreciate that answer. So we'll certainly keep our ears to the ground on any additional funding sources we hear of as well.
And I will also say that I'm not going to say it's on the table or off the table. We have not had a conversation yet. I have not had those budget conversations about my budget accounts yet. So it could be.
Okay. Yeah. No problem. It's early, I guess. It'll sneak up on us. Okay.
It will, for sure.
Great. Thank you. Thank you so much. Does anybody else have any additional questions for Patricia?
Hi, this is Marius Johnson, 3 Square. More so a comment, not necessarily a question. I can't tell you how thankful we are, and I'm pretty sure Reno can echo the same sentiments about the program, especially when we started getting those proteins. That was just absolutely amazing to be able to take receipt of those, and especially being free to us. So we're extremely hopeful that program can continue and it gets additional funding, because it was able to help us out in so many different ways. I mentioned proteins, but of course, there was some other dairy items. There was a lot of fresh greens, not to mention the fresh fruit that we were able to take receipt of. So we're truly, truly thankful of the program and hope it continues.
Thank you, Reese.
All right. Thank you, Patricia. We appreciate the update. And if, like I said to Kelly, if there's anything that the council can do to help, please just let us know.
Thank you for the opportunity.
All right. Well, we'll go ahead and close out agenda item 8 and move to agenda item 9 for possible action, discussion and possible action to determine future presentation topics by priority. So first we have the Community Food Access Project from the Nevada Department of Agriculture. Sorry, I missed my notes here. Let's see. Miss Taylor, I might need your help real quick. Or Miss Rogers.
No worries. So just kind of an update. This particular agenda item was just reflecting some of the presentations that we needed to get done regarding the SHIP. So we prioritized them. I did want to just make a quick note that, you know, we have reached out to NDA, but I know they're on the phone call today, and they have provided presentations at the last 2. So, I'm not sure if we want to reprioritize that so we can have some internal discussions to see when they would be available to provide that information at the next meeting. We have 2 meetings left in July and October, unless, of course, the council is interested in special session. But I just kind of wanted to recap on those and making sure that I captured them correctly, and those are still the council's priorities for the presentations.
Ms. Hoppy, go ahead.
So I'm not sure what you mean by the Community Food Access Project. We have 2 rounds of grants that we refer to as Nevada Community Food Access Grants. Both of those were state ARPA funded. We had an initial round that was about $500,000 that we awarded to, I believe, 6 different community agencies, and then we had a second round that was around $6 million. That was awarded to a number of agencies, probably upwards of 15 or 20 of all different sizes. So that's it's all passed through sub-awards to agencies, and they each have their own projects that we funded that they had to apply for. It was a competitively funded process. So that's the only thing I'm aware of when you talk about community food access at agriculture. And we do still have those ongoing. Right now, we report on them probably around quarterly to Governor's Finance Office. Are we talking about the same thing?
I believe so. And Ms. Rogers, I think, did you have something you wanted to add?
Hi, not on this specific presentation. I know it's coming up later on the agenda, but I just wanted to remind the council members that we do have the WIC presentation slated for the next meeting. So that is another presentation that we are looking at to meet some SHIP requirements.
Okay, great, thank you. Yes, Patricia, that is this, I believe the same thing. I think we just had it incorrect. So it would have been the grant, not necessarily the project. But we know that we've asked quite a bit of your department and wanted to make sure that we weren't asking for a presentation necessarily every single meeting. So wanted to sort of shift some of the priorities that we were asking. But we want to reshift sort of what I'm asking of the council this go around. So I'll check in this discussion, figure out what we need to do.
Okay.
Next time. So thank you for
Just
clarifying.
let us know.
I really appreciate it.
Absolutely.
Okay, so now that we've clarified that, so in discussions that I've had with staff, I know that we've had a couple of other presentation requests, but seeing as how we only meet quarterly, we kind of took some things off of the list because I didn't really want to bury us with work because we have a lot with the strategic plan and the SHIP. So we do have 3 things on this list. The first being, of course, the Community Food Access Grant presentation from Department of Ag. And then the next 2 wanted to see what the interests of the council would be to get a presentation from both of the food banks on sort of their 2025 needs and looking at doing that probably in October or later in the year. So we can plan for 2025 and have those discussions. So right now I kind of want to open it up to you all and figure out from this list, what are sort of priorities? Are there things that you want to see on this list, or do you think that this is sufficient? Lori, am I missing something? Go ahead.
Just wanted to also add, while we're talking about timeframes, just so that the council can keep on the back of their mind, that this year we're really going to try to get the council on food security's annual report out for a draft in July of this year, and then finalized in October, so that we can meet routing deadlines for when it's due to LCB January the 31st. next year. Just keep in mind that when we do that in October, we can try to anticipate what activities we have in place for November and December, so we don't skip those 2 months in that report out period. But just giving you some ideas and some timelines about that when we develop future goals for 2025, we typically capture those in that annual report. So just food for thought there.
Thanks. Thank you, Lori. I appreciate it. Yeah, so I'll open it up to the council.
Marcia Blake for the record. I think for us to be of any help or impact to the food banks, we need to be meeting early so that we have the opportunity to see what support they need from us. And if we do that in July, then we still have one more meeting where we could talk about it again if we need to. So I agree that the first 2 meetings with them would be really helpful for us to make an impact with the legislative session.
Yeah, absolutely. So you think we should move up the priority for them?
If we can, yeah, do it to the July meeting, I think that would be important, because once the election happens, we need to already have everything ready to go. And so if we wait until the October meeting, I don't think we're going to have enough time to be able to make the same impact as if we went with them in July.
Okay.
This is Deacon Tom for the record. I would agree with Marcia. The other candidate issue is, we will obviously get support from our food banks, but that's not the only resource that we use for product. And so I think knowing what their targeted priorities are helps us understand the user and the direct service providers better information about where they're going to focus, and then perhaps where we might need to augment that focus or support it in another way, so that we understand their priorities. So I think that it helps us to be strategic about what support we can give, and then also understand with respect to needs that are outside of the net of the food pantries, where we need to be focused on trying to tighten those nets up.
Okay. Yeah, absolutely. Any other comments or priorities we should be looking at? Dr. Malik, you're so quiet today. I don't like it.
I appreciate that. Sorry, I am distracted and my camera's not working, so I'm not a good participant today. I'm so sorry.
It's okay. It's all right. Okay. So I think then what we need to do is just renumber, and have our food bank partners present at the July meeting. So 1 and 2. And then Deacon Tom, just so I have this correct, have some additional partners, maybe like Catholic Charities, and is that what you're thinking?
Deacon Tom, for the record, thank you for the question. Not really. I think just for us, and probably for all of us, we worked obviously very closely with 3 Square, and they're such integral partners with us. But they're not the only partner that we deal with, other resources. Right. So for me, it's just hearing what they're going to focus on helps me to be able to decide where I can help the most.
Sure.
And then if there are sources outside of them that are sort of, well, I'll call them offline of this group, it just helps me to know, because we're such a huge, I think we're the biggest, proud to be, I think, the biggest customer for 3 Square.
I see what you're saying.
But it just helps us to know what their focus is, where we could help them. And then if we have other needs that we know we have to source elsewhere, whether it's directly through USDA or what have you, it just helps us with that, and probably all of us. And I know that's an ask. It's a calendar ask for the food banks if they're able to do that. I know that creates additional traction and work for them, but I think the end users like us would be helpful to get that information sooner rather than later, if it's at all possible. Thank you.
Yeah, absolutely. Absolutely. I see what you're saying. Yeah. And I think, there's opportunity with the interim health having their presentation on food security, next week. That'll be really helpful because they have us, they've got Office of Food Security, food banks, and welfare. And then we can have our own forum. So yeah, couldn't agree more. So I totally agree. So I think at this point, I'll accept a motion to restructure our priorities to have Food Bank of Northern Nevada, 3 Square, move to 1 and 2, and then Community Food Access Grant to number 3. And then we can work on the dates. If that's a clear motion, you guys can work on that.
So Marcia Blake, for the record, I move that we reorganize our focuses and put the 2 food banks before the community grant.
Deacon Tom's happy to second that.
Great. All those in favor say aye.
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 Aye. Sorry.
Okay. Opposed, nay? Motion carries. All right. We will move to agenda item number 10. Nevada Revised Statute, NRS 232.4969, Food for People Not Landfills Program Subcommittee updates. Ms. Taylor, please go ahead.
Sure. So we've decided to keep the the council decided to keep the Food for People Not for Landfill as a standing agenda item so that we can talk about some of those barriers and successes. Unfortunately, at this time, capacity within the Office of Food Security has been limited. We're still actively seeking out some partnership through NACDD. We have identified a person whom we would like to work within ACDD and hiring. So we're going to be routing that internal packet here pretty soon through our leadership to get them on board so they can help out with the project that we have for these food initiatives. And part of that's going to be also helping with the Food for People Not for Landfill. Unfortunately, we do have the list, but I've prioritized putting the SHIP work group first. And then as capacity allows, we would like to hopefully get our first meeting set by the end of this year is the goal. But I just want to kind of be open and transparent that I'm lacking some few staff right now, and we hope to get that moving pretty soon.
No problem. Thank you. Thank you for the update. We appreciate it. Does anyone have any questions for Ms. Taylor? Right. We'll move on to agenda item 11 for discussion, finalized annual reports, 2023 Council on Food Security, 2023 Food for People Not Landfills, and state fiscal year 23 Fund for Healthy Nevada annual report. Ms. Taylor, you're up.
This is Lori Taylor for the record. I am going to share my screen with the team so I can show you what's in the packet, which are the reports, so that we just go through each of one of them together. What I have first is the Food for People Not for Landfill, which is the 2023 report. This is supposed to go to legislation by January the 31st annually. The dates that we cover in this report is a calendar year. We have an executive summary and the overview for this particular report. What I will say is that a lot of our efforts was towards reestablishing who we wanted as a member of the subcommittee. And then we had some historical information embedded in here on what efforts we have done with locating some funding through Span and Reach, even though unfortunately we weren't able to get those grants. So, you know, just keeping the information out there that we're still seeking some active funding for reducing food waste in Nevada. So if you see any funding opportunities out there that you think would be of interest for DPBH and we can look at applying, please don't hesitate to let us know. We have identified in this annual report some future focuses for 2024 and what some of our next steps will be once we have some staff to be able to kind of jumpstart that subcommittee. Like I said, our goal is to hopefully do that this year. So that is probably, this report's pretty short, but you're welcome to look that over. We are in the process. We do have a PHAB worker who is our public, who works with NACDD. She is helping us write these reports moving forward as well. So she's going to be working on this year 2024 report. So if you see anything that you feel is of interest that I need to be aware about from looking over this current report, please don't hesitate to reach out and let me know. The next report we have is the FHN report. This is not covered under legislation, but it is a courtesy report for the council to review. It covers state fiscal year 23, which was ended last year, June the 30th of 2023. This report really goes over the funds for Healthy Nevada that come out of the tobacco settlement funds. And we currently have 11 partners. And within those partners, they may have multiple partners through pass-through partners such as food pantries and food market. Currently, you'll see a list. There's going to be a chart that is provided on this document that talks a lot about the description and objectives of each of those agencies and the amount of money that we awarded to each of those partners. It also talks about the counties that we served, so you can look over and see which location those counties served in state fiscal year 23. Do note that these partners are pretty large, like you know, and so they are servicing probably a lot more counties than are identified. This is really only focused on the FHN funds and what they're utilizing those FHN funds for. And so we also have a few charts in here talking about looks like those expenses and then the balance that was left over from state fiscal year. So this chart's going to show how many individuals were served unduplicated, the pounds of food that was distributed, and then of course talks about all the funds in addition to FHN of the pounds of foods that they have also served in state fiscal year 23. We did put some notes at the bottom if you're interested in looking at why there may be some differences in some of the data. Sometimes intake processes are different. We have the new 2024 report that's going to be coming out in probably about 5 or 6 months from now. We're hoping to have that routed internally. So hopefully by the end of the year, we can have the state fiscal year 24 out. And then let's see. At the very bottom of the report, there is some statistical report comparison that you can look at for individuals served by gender and race, self-identification. Looks like we have Hispanic and non-Hispanic population and what the FHN funds provide. And then, of course, it has a really good age of individuals that are served by the FHN partners as well. And just so you're aware, this information comes in from our 11 partners. They're the ones that provide it to us, and then we analyze that data and put it in this report for viewing. So I'm not sure if there's any questions about this report. Try to answer the best of my ability, but if you have any questions, don't hesitate to let me know. And then for the Nevada Council on Food Security, you've already read this report. This report is what you have already finalized. There was a few changes that were made internally with DPBH to get it posted. So you have the final copy here that was provided to LCB. The Council on Food Security report is calendar year. So it's January the 1st through December the 31st, and it is due to LCB by January the 31st of each year. And I don't really have much to add on this because we've already went over it in the last meeting, but if you have any questions on this report, don't hesitate to reach out to me as well. And that's all I have, Allison.
Dorian Stoneberger, for the record, it's through the 31st, but due on the 31st.
Sorry, this is Lori Taylor for the record. Let me clarify. It is a calendar year for the report, January the 1st, 2023 to December the 31st, 2023, and it is due January the 31st of the following year. So this report was due January the 31st of 2024.
I could have put that together had I tried.
Yeah, it was a tongue tie. Sorry about that.
All right. Thank you, Lori. Let's see. Does anybody have any questions for Ms. Taylor?
This is Deacon Tom for the record. Thank you, Lori, for that report. And just to maybe catch everybody up a little bit on the landfill issue, you know, before the pandemic, we had some traction by getting some of the larger resort properties re-engaged in this discussion of harvesting in convention food. Now, this would be food that, as an example, would be prepared for a convention, still in the tray, never touched, but that's either the overage or the shortage or the shrinkage, if you will, from convention traction on attendance. That was the product that was discussed being harvested and chill blasted. It's the same procedure that we use for our Meals on Wheels program. We prepare the food fresh, bring the temperature down very quickly, which gets it into a frozen point, which protects the food quality and the taste. And then moving that food, whether it be to 3 Square or directly to some of the bigger providers. That conversation obviously got suspended during COVID. And since that time, we all know that there's been mergers and acquisitions within the gaming industry. And so some of the partners and some of the folks that, as an example, that we would work with have changed or have, you know, been acquired or readjusted. So I think that's, given the fact that the convention business has returned into Nevada across the state in a big way since the pandemic. I think there's an opportunity to re-engage those properties again, and we're happy to help with that from my prior life in the gaming industry, plus the fact that, again, we were involved in that conversation. A big part of the issue, frankly, was the cost of the equipment. The equipment to both freeze the product and transfer the product was a bit of a hiccup, and so we had left the conversation on a few of the discussions that we had. I think perhaps Sarah might have been involved in one of these conversations. Was if we could acquire funding for a portion of the equipment and then maybe ask for some matching funds from the industries, so that the cost of the burden from buying the equipment could be mitigated. That might be a way to kickstart the program back up. And so I'll just leave it there. I know that program has a lot of potential, and we've always talked about, you know, there's buffet product and lots of product, and we tried to, from a legalese standpoint, stay focused on product that we felt we could control the ownership and the protection of the food, which was the untouched banquet food, which is a lot of product in most cases. And that would be a good place to sort of re-engage the engine for this discussion. So that's something, if we choose to want to revisit that deeper with the subcommittee or others, again, happy to add some additional color and participate in that conversation.
No, this is Lori Taylor for the road. Thank you for that feedback. We'll make sure that goes into the notes and then be able to present that information to the subcommittee as well, and present some of these notes so that they can stay well informed of the council's feedback as well. So thank you for that.
Great. Thank you, Deacon Tom. Any additional comments or questions for Lori? All right. Okay, we'll close out agenda item number 11 and move to agenda item number 12 for action. Review and possible recommendations on the state health improvement plan, action steps and objectives. Okay, so we will just go through each of these. So we've got 1, 2, 3, 4, 5, 6 to go through. So the first one is Objective 1, Strategy 1. This is the outreach to the Legislative Council Bureau to present to the Joint Interim Standing Committee on Health and Human Services. Lucky for us, they reached out to us, so we can cross this one off our list. So we are good to go. We're presenting on Monday. And Marsha, you and I were going to do this together, but so if you are interested in presenting with me, I can let the Legislative Council Bureau know if you have time. I know it's very last minute and they reached out kind of last minute. So, oh, you're on mute.
Sorry, do you know what time?
So it starts at 9. So I don't have a specific time. So, I mean, you kind of have to plan to be there most of the day. So I understand if it's pretty last minute and you don't have time, but
Okay, let me check my calendar.
Okay.
I think I'm pretty open on Monday. I try not to schedule a ton of stuff on Mondays because it always gets interrupted. So,
yeah, no worries.
So let me check my calendar and I'll get with you.
Sounds good. And I'll reach out to them and make sure it's okay, but and then I can send you slides and we'll just coordinate. But thank you, Marsha. I really appreciate it. Okay, so we're good on Objective 1, Strategy 1. The next one is the Food Conference Work Group, which is the group consisting of myself, Dr. Malik, Jenny Yeager, and Dr. Stonebarger. So this one, we met recently to develop a survey to disseminate to partners. But I believe we wanted to open it up to additional folks to join our work group. And forgive me, I just started a new job, so my brain is on fire these days. So Dorian, Dr. Malik, Jenny, please help.
Definitely. Dorian Stonebarger for the record. We were hoping to open it back up to the group with the potential of planning a Northern Nevada and Southern Nevada one in separate years. So for 2025, Northern Nevada, and 2027, I believe that I can be corrected on for Southern Nevada, being that there's such nuance in the regions and wanting to definitely make sure that we are catering to both areas. Jenny, does that sound like what we were hoping to do?
Yep, exactly.
So that means everybody has to pick a side. I'm just kidding.
Yep. That was exactly what I got out of that.
Yeah.
Dr. Janelle, for the record, I graduated both state universities, so I'm going to wear purple. So I'm going to see you on both ends.
I like it. Well, I think, we need a couple of people who are going to be on both for sure. So that there's the thought also being that having 1-2 years apart, there's going to be different topics that are really going to come into play, but at least we'll have people who knew, all of the setup for the first one as well and what was run into.
But we were, and you may have already said this, so I'm so sorry. We're sending out one survey, correct?
And probably another survey in 2026.
Right. 2026. So I don't think we were going to select people today, but if you wanted to join the work group, reach out to Lori. And we can get you added to the northern one, so we can have additional folks to help plan for that. Since it's coming up fast. It is April already, which is crazy. Am I missing anything else? Thank you for filling in those gaps. I appreciate it.
Sure. I am going to pull it up because Lori did also provide a little bit more, I think, of a timeline. Let me find that. unless she just knows it offhand.
Sure, this is Lori Taylor for the record. Yes. Our goal was set to be able to have the survey to the work group by this Friday so that they had time to review it so that they can give us feedback on what more questions need to be added, maybe going through another 2 or 3 rounds of probably some drafts before we finalize it. And then in the meantime, we still need to work through getting access to who we're going to send it to by the end of May. So really, I think the big heavy lift is going to be making sure our contact list are up to date for providers that we utilized in our 2023 assessment for the food security. Because we do have a list, we did collect all of that, but I'm sure all that information has changed in the last year or two and people have changed positions. So I still need to work out those logistics with Sarah and our team internally to try to figure out how we can streamline that and the workload. So that's where we're at currently.
Perfect. Thank you, Lori. Okay. Well, if anyone is interested in joining, like I said, please reach out to Lori. And we'll get you added to that work group. And we'll get this conference moving and shaking. Okay. So we'll move on to objective 2, strategy 2, which is the food conference work group to identify who from the housing, transportation sector, and tribal communities will present to the council and fair/conference. This one is due by, oh my God, why can't I think right now? December 31st, 2024. So I think we can task this as part of our working group, so we can move on to the next one. Our next one was welfare SNAP presentation related to grants, which we just had today, so we're good. Next is begin discussions and helping the work group identify a minimum of 2 service providers in attending in person to both Southern and Northern Nevada Food Security Fair and Conference. Transportation service providers shall include, but not limited to, services that bring the food to the people and the people to the food with equity among the rural and urban communities. So another task for the work group. So I think we can move on to the next one. Objective 4, strategy 1 is 4 presentations are required, and this is due by December 31st of this year. On January 16th, 2024, NDA presented on the summer food program and DWIS presented on SNAP today. And then special supplemental nutrition program for WIC presented on, it's scheduled for July 16th. And then we've reached out to NDA to present on the Home Feeds Nevada. So we're just waiting on one more presentation. So we already have 3 out of the 4. So we're making pretty good progress on that goal. So far we're doing pretty well on these goals and objectives. So just a lot of work for our food conference work group. But as far as the ship goes, I think we're making pretty good progress. So any comments or questions on the ship? Okay. Sounds good. I will close out agenda item 12 and thank you, Dr. Malik. And move to agenda item 13 for discussion, remaining 2024 Council on Food Security goals. So possible topics. So these are pulled from the 2023 annual report and can be pushed to the 2025 goals for the 2024 report if needed. And we can keep it as a standing agenda item. Sorry, I'm just getting my thoughts out. Okay, so I want to run through these topics. And if there are specific ones that are higher priority for individuals or things that are missing, or we just want to rid of these that, you know, we don't need to do them, just let me know. Or in kind of the interest of time, we can read through them. Actually, yeah, let's do that in the interest of time. Let's go ahead and everyone can read through them and let me know if anyone is okay with these, or if you'd like any of them pulled, or if there are some that are like super high priority that you think we should be focusing on. So I'll go ahead and open it up to the group on this.
So Marcia Blake, for the record, the two that really stand out to me are the home delivered meals program, as it is not a sustainable program in the state of Nevada. The cost to prepare a meal, even in the most cost-effective way, and get reimbursed less than $4 or a little bit over $4 for that meal that definitely cost you way more than that, is not a sustainable program. And the other one is the food insecurity, how it's being addressed in hard to reach areas or food deserts. I think we don't do a great job in this state of addressing those hard to reach areas and food deserts because we lack resources. We don't have the resources to get out to those areas, but we have to fix that because it's more and more and more and more seniors. That's where the majority of the seniors live, or in those hard to reach areas and food deserts. And they're turning 65 and 66 and 67 and 70 and 80. And so we have to be able to get food into those areas.
Yeah, I agree. And I think with the emphasis on transportation that we're taking, I think that we should be really looking at food deserts and hard to reach areas. And I think that we should prioritize that. Anyone else?
Hi, this is Dr. Malik for the record. This first one with the focus on distribution and support for general food access. I mean, I guess food distribution is on here a few times, and that's the biggest burden on our agricultural community. They're growing all this food, but they cannot get it out to retail environments. And they need that support, and that's where Home Feeds Nevada has been like such a big help to them. So I think if that's one area that we could focus on. I know the Small Business Development Center at UNR is working on some kind of program for food distribution. But I think other states have like an actual system for food distribution that if we could try to focus on and instill in Nevada would do a lot for food security in the state.
Dr. Pam Janelle, for the record, I'm curious to know which department at the University of Nevada covers that. Is that Cabinet?
Let me see.
Oh, sorry. I thought you knew off the your head because I was curious if it was not the business end or if it was Cabinet or the College of Agriculture, Biotech, etc.
It's not Cabinet.
Okay.
I don't know who they're under though.
Okay. Because that would be.
Yeah, it is the College of Business. Yeah.
Okay. All right. Thank you so much. That's really helpful.
Okay. So I think are these, and Marcia, maybe you can help. Do you think these are goals that we should focus on like right now? And maybe this is a better question for Lori. Are these things that we can focus on now, or are we too bogged down with other things? And we need to push them.
So Marcia Blake, for the record, the home delivered meals program, that is a finance situation. And
Yeah.
so if we don't start having those conversations right now, then we can't set up meetings with the governors. We can't set up meetings with the committees. Because the only way to continue this program is for there to be more funding, whether it's through state funding or federal funding, more federal funding we can get to the state. However, those conversations need to happen before the legislative session, because we have to have more funds to cover the cost of these meals.
Okay. No, that's helpful.
The other one, I think part of that will be addressed with the home delivered meal situation, at least on the senior side. But I also agree with Dr. Malik in that we can't let food that's really good food go to waste. There has to be a way for us as a state to figure out how to make sure that those resources that we do have stay in our state and benefit our citizens. Because if we have another emergency and we have to shut down freeways and borders and we don't have trucks and we don't already have a system in place to get those food and the milk and the meat distributed to people in the state of Nevada, then it's a complete waste.
Okay. So I think that, yeah, I agree. So we should be putting these as part of our 2025 goals, so we can advocate for them as part of our advocacy strategy going into the legislative session. And if there's funding asks, we can say, you need to put X amount of funding into home delivered meals, et cetera, et cetera. Right?
Correct. And Deacon
Okay.
Tom can probably speak a little bit more to this. It definitely affects him the most.
Yeah.
But it also affects those of us who have smaller home delivered meals programs and congregate meal programs and all of those things as well.
Yeah, thank you. It's Deacon Tom, just quickly, we're serving today 2,500 seniors every day. And as Marcia said, Catholic Charities is the largest financial supporter of that program. We're the operator, but we end up putting more money in than anyone else, the state or the federal government. And that is an unsustainable situation. We have 1,000 people on a waiting list right now. And, as a state, we're marketing to seniors to come here, retire here, come for the low tax burden, come for the weather, come for the quality of life. And then when seniors get older and one of them passes away and they lose part of their income, they get into these pickles where they don't have food. And I've said very respectfully to our legislative leaders, if an organization like Catholic Charities or Helping Hands can't do it, it will fall back to the federal government. It'll fall back to the state HHS or the county, and it will be a lot more expensive for them to run it. And frankly, a lot of those people would end up having to go prematurely into assisted living if they don't get food, which would become a huge burden on Medicaid. So, it's a really good investment. I mean, I know all the great work that is touched on by this council. It saves lives. The senior hunger one is absolutely fixable because there's an engine that works that provides these programs. It's just a matter of they need more funding. The engine doesn't have to be created. It's already there. So, but it is a situation where it says, as an example, if I can't raise about $5 million a year privately, just for Meals on Wheels, then I have to start allowing the attrition when people pass away or go off the program, not to take people off the waiting list, and that would be the last thing that I would ever want to do.
Yeah.
So it is a critical issue for our state, because it is a population that's growing here, the senior population, aging in place with dignity and compassion, which is what these programs allow people to do: stay home and be where they want to be and where they frankly should be. And it's a lot less expensive. It prevents people going to the ER and begin all the other things that we know happen when seniors suffer in silence.
Yeah. Deacon Tom, I know you and I had quite a few conversations about this last session. Can you remind me, what was the dollar amount that you had asked for Meals on Wheels?
Just in round numbers. So Marcia mentioned the $4 that we're getting.
Yeah.
Our program, our cost of meal is a little under $9 a meal, all in. And that's delivered food. That's even an increase in pricing these days with food and gasoline and food costs. And so we were having to put in about $5 a meal. Our required match is 15%, and we're putting in 50. So my ask was $3 a meal across the board for every provider. Still creates a liability, but it's also, all due respect, knowing we're sitting on $10 billion of cash that Mr. Cohen's managing for us beautifully. That there are something in that range of $3 a meal across the board would put a huge dent into the current program. Now, not the waiting list, but I always like to say you have to take care of the first floor. If the first floor is on fire, you can't build the second floor of the house if the first floor is on fire. So that's to make it simple, and we got that done. This council helped when we have our first group. We were able to get a 50-cent a meal adjustment by Governor Sandoval, and every provider got it across the state, which is exactly what should happen. We were very involved in helping to share the message, but it's not about us or anybody else. It's about the seniors. So to me, having that priority and then having it related to a dollar amount per meal would create equilibrium across all the providers, knowing that some providers, it's going to cost them more, especially if you're working into a rural environment. I'm sure Marcia's transportation costs are higher because of what she's doing, but a dollar per meal at least creates some level of equilibrium.
Sure.
This is Dr. Osgood. Can you hear me?
Yep, we can hear you. Go ahead.
I'm the one who made the presentation, and I just brought up my slide. And we were asking for a reauthorization of the current funding of $3.4 million for home delivered meals and congregate meals. And we asked for an increase of $8 million because of the loss of federal funds, inflation, and anticipated increased demand. And we got less than half of that.
Okay. Thank you, Dr. Osgood. That's really helpful.
Mm-hmm.
So, and Jenny may be able to speak to the situation in Northern Nevada. I know that there were some senior centers that didn't reopen after the pandemic. So she may be able to shed some light on that situation in Northern Nevada.
Sure. Jenny Yeager for the record. To my knowledge, all of our senior centers have reopened in the north. Their capacity has been impacted some. So some have still not opened at full capacity, but they've all reopened in some sense. Part of what we've seen up north also is a challenge in getting seniors back into the senior centers, which is that's causing, I think, some of the challenge of trying to bring programming back up to the pre-pandemic levels because they're having a hard time getting the seniors to come back. But I can tell you that the need is still extremely high. So when the pandemic level SNAP benefits ended, we saw a huge influx of seniors almost immediately coming back to both senior centers, CSFP programming, Produce on Wheels, Golden Groceries, looking for assistance because they had been able to meet their need with that pandemic level of SNAP. And as soon as that was gone, they were instantly impacted again. So the ability to be able to continuously provide that consistent level of high quality meal for those seniors is critical. And I have not talked to one director of a senior center who has said that the current rate of reimbursement is adequate. So everybody's struggling to be able to determine how are they going to fund these programs indefinitely, especially with the concern around an increase in the number of individuals who are moving into that aging or that senior population.
Thanks, Jenny. Dr. Malik, you had a question. Is this funding dependent on the farm bill? Yeah.
So partially, it's also funded through Title III, the Older Americans Act, which unfortunately our state does not get the percentage of those dollars. It's supposed to be based on the percentage of seniors, but it's not. And so it's a matter of our congressional leaders trying to get our fair share of what that is. Our numbers keep increasing and other states' numbers decreasing, and their funding isn't decreasing and ours isn't increasing. So there's got to be some adjustments that way for us to get our fair share of the Older Americans Act money.
Dr. Malik, for the record, sorry, I have access to all these grad students that are looking for projects. So I'm just wondering, like, what can we put together that would help this? Like, do we need legislators to understand that they need to be going after this funding, or how this impacts? Like, is it just a matter of putting together an ask?
This is Deacon Tom. I'll just take one shot at that. The short answer would be one of the successes we had when we got the first level of state funding increase was to show the ranking of the state of Nevada's funding for Meals on Wheels as compared to other states in the nation that had similar size. And not surprisingly, we were at the lowest in the nation. And so that kind of information from a research standpoint, and then to package that in a way that allows us to be able to present that to our legislative delegation, realizing that we all know that every 2 years we're dealing with a 30 to 40% populace of legislators that are new to the system and new to everything. And so, and I'd be happy to talk to you offline about that. I think there are some tools available that I use to educate our legislators on how much the revenue how far it goes, and the people in their district that get it, and the average population and demography. So, welcome to reach out to me. I'll put my contact info in the chat, and you're welcome to reach out to me. I'm happy to have a sidebar conversation about it.
Perfect. Thank you, Deacon Tom.
Okay. I think that helps. Oh, I'm sorry, Lori, go ahead.
No, that's okay. This is Lori Taylor for the record. I just want to provide some administrative support for the council and drop in the NRS duties into the chat, because the very last one on number 10 does allow for an avenue for your recommendations to LCB in your annual report. So I think that might be where we kind of want to have that recommendation potentially lie, but I want to just kind of provide it to the council for consideration. And a reminder that in July, we'll provide the draft on the report, and then October we'll approve. So if someone in the board is willing to provide me with a recommendation, like a couple of snap sentences, I'm happy to put it all together for you. Just some thoughts and feedback. I can also recap in the minutes our discussion today as well too, and pull from there if that's also preferred.
Yeah, I think that'd be great. Okay, I think for agenda item number 13's purposes, we can box this together a little bit. So I think it makes sense to parse out home delivered meals, food insecurity, being addressed in hard to reach areas, and or food deserts. I think we have two items focused on food distribution. And then the home delivered. Did I already say home delivered meals? So I think we can focus on those. and maybe we'd move those ones to our 2025 goals and have those be part of our, at least our recommendations for for LCB. Does that work for everybody?
Dorian Stoneberger, for the record, it's all under the umbrella of access on both sides. So I think it all works really nicely together.
Okay, great. Does anybody want to make them? Oh, no, there's no action on that. So I think we're good. Do we need to take any action on that, Lori? Or do you need action?
I don't believe, oh, go ahead, Sarah.
Sorry, Sarah Rogers for the records. No, we're good. Thank you.
Okay, we're good. Perfect. Then we're done. Unless anybody has anything else. Okay, good. Closing that agenda item out, and we'll move to agenda item number 14 for possible action for future agenda items. So we have the future standing agenda item on food for people not landfills, and then the SHIP action steps. And then we have the presentation from WIC, which we have in July. Sarah, did you have anything you wanted to add on that?
I do not. If there's something specific the council would like to hear about WIC, let us know, but hopefully we will have some more updates to provide on the collaboration meetings that we've been having with DeWiss recently that Kelly mentioned earlier.
Great. Nope, just really, really looking forward to that presentation. So thank you. Thank you for putting that together. And then we have the 2024 council annual report draft. Any other agenda items that members of the council would like to see at future meetings? All right. I will close out agenda item number 14, and we will move to the second time for public comment. And I got to go back up to the thing. Hold, please. Public comment may be presented in person, by computer, phone, or written comment. To provide public comment telephonically, dial 775-321-6111. When prompted to provide the meeting ID, enter 650-810-653#. Due to time considerations, each individual offering public comment will be limited to not more than 5 minutes. Persons making comment will be asked to begin by stating their name for the record and to spell their last name. You can also submit written comments electronically before, during, or after the meeting by emailing Lori Taylor at l.taylor@health.nv.gov. Does anybody have public comment? All right, seeing none, I will close public comment and open agenda item number 16, adjournment. I will accept a motion to adjourn.
Dorian Stoneberger, I move to adjourn the meeting.
Marcia Blake, I second.
All right, all those in favor say aye.
Bye.
Aye.
Aye.
Opposed, nay. All right, motion carries. Thanks for a great meeting. I appreciate the discussion.
Yes.
And
Thank
I
you.
will see you all in July, and I hope you all have a great rest of your day.
You as
Don't
well.
leave me,
Bye-bye.
Jenny.
Jenny, you were so sad.
I know where you work.
You'll find me. Charlotte's wonderful. You'll love Charlotte.
Yeah, but I love you, girl. All right.
Thank you.
Bye.
Bye.
Bye.